All right, then. So let's touch down on health this morning. It's been quite a while we reflected on our health, but today it's a very, very unique one. So those of you who are in the realms of speaking grammar, so to say, you must be ready for this one. It's called hyperprolactinemia. I'm sure you've not heard of it before. All right, so we're trying to understand what kind of ailment that is and its impact on our lives. And joining me in the studios this morning, Dr. Raphael Ibidapo is consultant endocrinologist, and he is with Rjolad Hospital. He's making another comeback today, and this morning is going to be taking us on an excursion through this particular ailment. Dr. Ibidapo, Raphael, nice to have you in this building. Good morning.
Thank you for having me. Good morning.
And how are you doing?
Very well.
It's been quite a long while. We had you on this frequency.
Yes.
So what's up? What's going on?
Fine. It's been work, and I'm glad to be here.
Okay, then. So let's touch down on this. Hyperprolactinemia. I beg, break it down for us. What is it really? What kind of a health condition is that?
Okay, so hyperprolactinemia means high prolactin level in the body.
Okay.
Prolactin is a chemical, is an hormone produced in the brain.
Okay.
Basically, the importance is to regulate how women particularly produce milk.
Oh.
Yes, in expectation to feed the babies.
So is this an ailment common to women?
No, it's not only women.
Okay.
Both men and women, men and women do experience that kind of
illness.
Yes.
Okay. All right. So, like you said, it's something that is related to how milk is being produced in the body. Is that correct?
Yeah, absolutely. So the way God has designed our bodies is such a way that there are some chemicals that help us to develop our body in expectation of particularly for women to breastfeed their babies. So for many reasons, when things go wrong within the body, these hormone can start, the level can begin to rise. And when such happens, the symptoms that you now get will look as if the person is breastfeeding without having a child.
Wow.
Yeah.
So how common is it?
It's quite common amongst particularly women. Although, like I said earlier, it can occur both for
male and
in men and both in women.
I'm just wondering how that would affect me. From the way you're describing it, it looks like an ailment or perhaps a kind of condition that is likely to affect more women than men.
Yes.
So if you put 10 people in a room, how many women will be affected?
Close to 6.
6?
Yes.
Okay, so 60-40
yes.
will be the ratio.
Yes.
All right, but in Africa, perhaps, or in Nigeria here, is it very, very common?
It's actually common, but a lot of people do not really, I'm not aware.
They're not aware of it.
Yeah, exactly, they are not aware of the illness. So most of the time, they don't see that as a problem, and it's very significant because, particularly both for men and for women, it can actually impact on their fertility.
All right. So can't we just refer to this as hormonal imbalance?
Well, when we say hormonal imbalance, it's quite a lot. It's like an umbrella of many things.
Okay.
Yeah, it's just one out of many hormonal disorders.
So the hormone here that we're talking about now is what?
Is the prolactin.
Prolactin.
Yeah.
Responsible for producing milk.
Yes.
Right. Do men produce milk?
Yeah. So men do not naturally produce milk. Except when this hormone starts rising and gets to a very high level in the body, they can express milk in their breast.
You mean it?
Yes.
That sounds amazing, really. I've not heard of that before.
Yes.
But what are the signs or perhaps the symptoms of hyperprolactinemia?
Okay, so like I said, when you have high prolactin levels, it can actually impact on the fertility. So when a woman sees that you're lactating, more or less your breast is producing milk, and you're not pregnant, that tells you there's a problem. The other important thing is your menses. When a woman sees that the menses are not regular, okay, that can also be a problem.
You mean it?
Yes.
Because that's a common one, irregular menstrual period.
Yes. So when we say irregular menstrual period, quite a lot of things can cause that.
Okay.
One of which is high prolactin levels. Yeah. For our men, when we see that our energy level is low, the libido, the desire to have sex is low.
It's very low.
Yes. That could also be a problem, and you may need to check the
Dr. Ibidapo, you're touching down on very sensitive areas now. I'm sure some men are going to be very interested in that one. But let's even look at the aspect of the irregular menses. So what do you mean by irregular? So
when normally, usually for our women, their menses it
goes through a circle, right?
Yes, it goes through a circle. Exactly, that is predictable. But when you now see that the menses barely comes and is no longer predictable, you don't even know when you're going to come.
So instead of 4 weeks, it goes 5 weeks.
Exactly.
Or sometimes it goes 3.5 weeks.
Exactly. Some even don't. Excuse me. Some don't even see it for months.
You mean it?
Yes. So, and you now notice that you're also producing a breast milk
at the same time,
and you are not pregnant. Then you must check your prolactin levels.
So what would you say to those who have said, well, for ladies that experience irregular menstrual period, maybe it's as a result of some kind of infection rather than hormonal imbalance, so they say?
So infection can also cause irregular menses, but in this setting, most of the time they do not express milk.
Okay.
Yes.
So if it's accompanied by expression of milk from the breast,
exactly,
it eventually means this is this particular condition.
Exactly.
Wow. Okay, so that's one symptom, or perhaps two symptoms. Any other symptom?
Yes, I talked about for the men, low sexual drive, reduced libido. Most of the time for the men, they also experience that expression of their breast milk.
Oh, you mean you have discharge from the breast?
Oh, yes. So sometimes the breast milk can come, not just flow like that.
Wow. That's abnormal anyway. In any case,
if
a man is beginning to have secretions from his breast, definitely that's an abnormal situation.
Absolutely, it is.
Okay.
And most time that is what gives them that worry.
Right.
Okay. Yeah.
Okay, because I would have said for the low sex drive, a lot of people have brought in lots of things that could be attributable to it. Maybe some would say maybe they had too much consumption of sugar levels or the likes. So don't you think that could be?
Okay, so for low sexual drive, quite a lot of things can actually be responsible. It's a whole lot of things.
Okay.
Endocrine wise, that's hormonal wise, the vessels that conduct blood also can be affected. So when we look at that, it's not just eating sugar alone. Okay. Diabetes is also a very important cause
of that.
And yes, and also this condition we are talking about, hyperprolactinemia, can also be an important cause.
It's nice that you're bringing this to radio this morning, because I'm sure some men would have had this kind of experience. Probably they had some kind of secretion from their breast and they're just wondering, well, what can this be? Maybe it's just stress levels or that kind of a thing. But how does this affect daily life, Dr. Ibidapo?
Yes, so it does affect our daily lives, particularly both for men and for women. Just like you rightly expressed, if a man starts expressing breast milk, and he looks at himself that I'm not a woman now, and I'm not and I'm not pregnant. So that in itself keeps him worried. It can actually disrupt his daily life, because he thinks of it as something. Could this be a sinister thing going on? Is there something more to this that I'm not really aware of? So I think for women, the same thing.
The same thing as well. Yes. All right, then we'll get to some more other things. So, but what could cause all of this?
Yes. So sometimes the causes could be physiologic. In other words, it could just the body's response to either stress, to trauma around the chest. You could have high prolactin levels, but that shouldn't really be a problem, because once that stress is dealt with, the levels come down. But for most times when the values are very high and it becomes a problem, tumors in the brain,
could be responsible.
Yes.
Wow.
Yes.
All the way from the brain.
Yes. You know, you remember I mentioned that the prolactin is produced in the brain.
Right.
So when you have some brain tumors in the pituitary, it can actually cause high prolactin levels, and that could be a problem.
Right.
Yes. The other thing is we all have our thyroid gland just in front of our necks. When the thyroid is not producing enough, then the prolactin level can also be high.
I thought the thyroid was responsible for regulating our temperature and all of that.
Oh, the thyroid does way more than that.
You mean it?
It does quite a lot of things.
This is revelation, really.
It does quite a lot of things.
Right. Okay, so you've just given us what it is in terms of the causes and how these things could begin to manifest in the body. In terms of diagnosis, Dr. Ibidapo, how is it diagnosed?
Yeah, so number one thing is to come to the hospital so that the doctor can examine you properly and look at the breast discharge, look at other things. Another important thing is we do blood works, so blood checks. Then we check the prolactin level itself, see the level. I didn't mention that medications can also be responsible for high prolactin levels. So sometimes we take medications and we don't even know that some of these medications have impact on our hormones. So those are the things that when you come to the hospital, they look at. And then you can do a scan of the brain. If it is a tumor in the brain, that can pick it out, and then it can be dealt.
This ailment is so discriminatory. I would have expected that hyperprolactinemia would be much more in terms of the way it shows itself for male would be quite different from the way it shows itself for female. I mean, now we know that if a lady is producing excessive milk and you're seeing that from the breast, that's for women. I would have expected that for men, probably excessive semen would have been a kind of manifest symptom for this kind of ailment. But what do I know? Like I said, the disease appears to be discriminatory. All right. So, but in terms of the test, what kind of test can one do?
So we do prolactin levels. We check the prolactin. Then we also look at the scan, the brain scan, and then of course other important organs are also looked at. The kidneys, importantly, and also the thyroid. Importantly.
Right. Yeah. So are there different types, or is this just one strain of hyperprolactinemia that we have? Do we have different types of it?
No. It's just the same hyperprolactin levels, but the causes may be different. So based on those different causes, then they can be addressed.
Can we look at some causes apart from the ones you've mentioned now? I mean, for a woman, what are the regular, what are the kind of causes?
Yes.
But just hold on 1 second. Let me take this call. Hello there. Good morning.
Hello. Good morning.
Yeah. Good morning, Raphael.
Yeah. Good morning, Victor. Right. As the earlier reported incident at the new garage in Ojota, where we reported of the truck, 40-feet truck that blocked the entire service lane. I want to confirm to you that it has also been taken off the road. It has been cleared off, so we have a good movement now. Both in and out from Ojota down to Maryland is very, very good.
Okay then. All right. Thank you so much, Raphael.
You're welcome, Victor.
Okay then, so that's the impediment we talked earlier on, which we also got the signal that has been taken off as well. All right, so you just about telling me some other causes, right?
Yes. So I mentioned medications. Quite a lot of medications that people use, antidepressants. Yes, and some of these drugs, people use it without knowing the consequences that can arise from using those medications. So one of which, I mentioned antidepressants. Some antiemetics, those that prevent vomiting, for instance. Yes. So can also disrupt or cause that elevation in the prolactin level. Okay. So prolonged use of these medications are not usually advised.
All right, then. Lagos Traffic Radio 96.1 FM. This morning on the program, we're trying to really understand and look for best ways of managing hyperprolactinemia. And of course, it's we look at its impact on life. And Dr. Raphael Ibidapo, who is a consultant endocrinologist with Rjolad Hospital, is our guest on the program. Very shortly, I also allow you to join the conversation so that you can also ask your questions as well if you want to. But those of you on the Ojota corridor, you just heard from Raphael. Of course, we had an impediment there earlier on, but that has been taken off. Masha Aguda corridor, good movement is being experienced from Onile Gogoro up to Masha Bridge, connecting Kilo, moving at a fast pace. From there, linking up with Nobi Street is also looking good. Nuru Oniwo connecting Nepa is appreciably good as well. We can tell you, Otuaba linking up with Lawanson is good. And then from there, connecting Ogunlano Junction, proceeding through the traffic signal light is still looking good as well. Ogunlano to Randall Junction is moving at a very good pace at the moment. Likewise, for the return journey, Otuaba also looking good. Eric Moore inward Abebe Village down to Igomo Bridge is also looking good. Likewise for Jimo Udutola, very good too, moving at a fast pace. And I can tell you, all through that corridor, things are still looking very fine. All right, then. So if you want to join the conversation, feel free. 080-99-120-777, 091-5387-7127. All right. So we're talking of a particular kind of condition which might affect your hormonal imbalance, but not just for everything, but it's the hormones that produces milk. All right, in the body. Is that not correct, Dr. Ibidapo?
Absolutely. Yeah.
All right.
Yeah.
You've told us about the causes.
Yes.
Is it curable?
Yes, it's actually very curable. It's one of those conditions where you have a brain tumor that is secreting that you can actually treat with medications.
When people hear brain, they are normally scared though.
Yes. So I'm trying to use the word brain because there is just a particular gland in the brain that produces that prolactin level, and for most of the condition,
all right,
we use just medication to take care of it, and that works very well.
Let's talk about Rjolad Hospital. What kind of remedy are you guys bringing to the table?
Yes, so what we are bringing is a multidisciplinary approach to managing this condition. So we have the gynecologist, the endocrinologist coming in to address any of the complications that can arise from this condition, and then also an endocrine panel to diagnose the condition and then treat appropriately.
Right. So let's talk about age now. Is it age discriminatory?
Oh, absolutely not. Yes.
So you mean even young ladies in the studios like I have here now, they can contract this kind of ailment?
Yes, they can. They can have it. Yes.
Even somebody who's 18 years old?
18 years old, yes. So usually, most of the time, what we see in our clinics, we see age between the 20s to the 40s.
Wow.
Can also present with this. And if you notice that age group, that's the reproductive age group.
That's right. So any person from age 50 might not be able to contract this?
Not that they cannot have it, but it's not usually common in that age group, yes.
Okay then. 09153877127. We're talking hyperprolactinemia, which is a condition that affects the stimulation of perhaps the production of milk in the body. And Dr. Raphael Ibidapo is here. If you have any questions for him, feel free to bring it on board. Especially for you men, I'm sure you must have heard of the part when he said libido can be affected. Is that correct?
Yes.
Okay.
Yes.
So I'm sure you might want to ask questions that relate to that. There's one question here. It says, "Good morning, Traffic Radio. Please, could it show up without any symptoms?" Onyeka is asking this question. Onyeka, thank you so much.
Okay, so thank you for the question. Most of the time, it comes with symptoms. The levels can begin to rise. Okay, and once it gets to a certain peak, those symptoms definitely will come up. So for the women, it's easier to detect because once they see their menses is beginning to, there's a problem going on there, they quickly go to the hospital, and most of the time they do the prolactin levels and have it checked out. But for the men may think, oh, well,
it's just normal.
It's just normal.
Oh, perhaps I've taken too much sugar in my body.
Exactly. So they may not seek for help early enough for them to know that there is a problem.
All right, so men, now you know. This one says TGIF. How is it diagnosed? Is it via a blood test? Alowonle is sending this one in from Idimu. Alowonle, thank you so much. Even though he mentioned it earlier on, but doctor?
Yes, so it's through a blood test. So from the blood test, we know that the prolactin level is high. Then we begin to ask questions, why is it high? And then we can do some other blood tests to find out why it is high.
Okay, all right. So Alowonle, now you know that 08099120777. It's absolutely curable, doctor?
Absolutely curable, depending on what is causing the high levels of prolactin. Yes.
Is it possible for one to have more than one bout of hyperprolactinemia?
Well, the challenge with hyperprolactinemia is that even when you treat it and you stop using medications for it, it can actually come back.
It can reoccur?
Yes.
Wow, that's dangerous.
It can reoccur.
Okay.
Yes.
All right. So, but for men, you did say that perhaps the most noticeable symptoms would be the fact that the libido is very, very low.
Yes, sir. Yes.
Wow.
So it's for the men as well. We mentioned that when you start seeing that you are expressing breast milk, you press your breast and there's milky discharge. That tells you there is a problem also.
Will you come with a lump? I mean, before you have a milky discharge, is it likely that the breast might have a kind of lump there?
There may not be lump there.
But the moment you press it...
But the moment you try to express...
Wow.
There is a milky discharge, you know there is a problem. It's not, you're not supposed to have...
That seriously, for a man.
You're not supposed to have...
Serious really. Okay, this one says, good morning. Let's say, it says, good morning. Do prolactin levels fluctuate? Let's say monthly in women. You put your name. Thank you so much.
Okay, so the prolactin levels do not actually follow the monthly cycle. The prolactin levels follow sometimes stress levels. So if we mention stress as a cause of high prolactin level. So sometimes when you have a stressful event, your prolactin level can go up.
Okay.
Yes, but they do not follow that cycle. They, however, can control the hormones that follow the that circular monthly.
Doctor, how often do people present with this in your clinic? So
we see very young reproductive age group women, and both men actually, present with this very often in the clinics.
Okay.
Yes.
And once they come around, they do the test that you've mentioned?
Absolutely. So that's what we offer at Rjolad. They do those comprehensive endocrine panels, the prolactin level, they look at their other fertility hormones, and then we are able to detect whether the prolactin level is high or not.
In terms of management of this, really, how long will it take? I mean, somebody who contracts this, would we say in the next 3 months, 4 months, will he be out of it?
Well, like I said, it depends on what is causing it. But most of the time, when it is due to a brain tumor in the brain that is secreting prolactin, the person will have to use those drugs for at least 2 years.
Wow, 2 years?
Yes.
Before
we can say, okay, it's okay.
Wow. Okay, in terms of the future for a woman now, so someone who's listening to us right now, a woman contacts this and is worried. What is going to be the outlook? Can the person still can he have a child?
Oh, absolutely. So once we start the medications and the hormone level starts coming down, the menstrual period will become regular, and then there can be conception.
Okay.
So it's very treatable. Very, very treatable.
And I remember you mentioned that infertility is one of the symptoms, right?
Yes. So it's one of those key hormonal disorders that can cause infertility.
So those who are married and perhaps they've been having this kind of condition, they never knew what was going on.
Yes.
So perhaps this is what is responsible.
Absolutely. It could just be. So it's important that they come to the hospital and have it looked at.
All right. This one says, good morning, Victor. Does it affect pregnancy or breastfeeding? Cynthia is sending this one in. I think he's talked about that, right? He does, right?
Yes. So for pregnancy, like I said, it can impact on conception because it will prevent those hormones that help with conception, prevent them from being produced in the body. So it can impact on getting pregnant. Yes.
Wow. All right. But even though that's the case, but Dr. Ibidapo is telling us this morning it is curable. So the first thing is for you to ensure that you get to the hospital on time.
Yes.
Delayed diagnosis. Is there any outcome, any consequences?
So the consequences are that for the men, they have low testosterone. And low sperm count as well, because the testosterone is responsible for producing sperm. So when the person is exposed to high levels of prolactin, it can actually impact on the quality of the testosterone level that he produces.
And in that case, for him to impregnate a lady,
of course,
will become very difficult.
Yes.
Aha. So those of you who are experiencing that, perhaps very low testosterone levels, as a result of this hyperprolactinemia, rather. That's what the doctor is saying this morning. 08099120777. This one says, Doctor, is it true that it can cause bone loss over time?
Oh, yes.
Mr. Ambrose is sending this one in. Mr. Ambrose, are you a doctor? For you to know that.
Okay. Yeah. So it can actually cause bone loss in the long term. I talked about the testosterone levels.
Yeah.
Once the testosterone levels are low, the quality of the bone, the strength in the bones also goes with time. So it can indeed cause bone loss. Yes.
So when you see people, sometimes they trip and they fall and the bones are broken.
Yes.
Could it be as a result of that?
Yes. For most of the time, in the elderly, that you see that elderly people sometimes fall and they break their bones. So it's because of those low hormones in the body.
Wow.
Yes.
Any remedy for old age? Dr. Ibidapo?
I wish there were.
Talk to me.
No remedies for now. But I think the important thing is eat healthy, exercise well, and the bone strength will be preserved.
Because I'm sure that people that are listening to us right now, they'll be looking at, or perhaps they're thinking, what can I do to really get myself out of the web of a kind of condition like this?
Yes.
And if there are other things, people have been talking about things to stay healthy while you grow old.
Yes.
People have talked diet. So is diet one inhibiting factor for this kind of condition?
Well, it's always important to eat healthy. It's not just for hormonal balance, it's also for health and wealth. So it's anything, whenever you have the opportunity to eat healthy. Choose, correctly. Don't eat a lot of junks and things that will be harmful to the body.
Okay. All right, let's begin to wrap this all up now, because there's a lot that one can do. But for point of emphasis, let's touch down on this ailment once again. So, hyperprolactinemia, what is it, and how does it occur in the body?
So it's just the body producing high prolactin levels, usually which is expected in breastfeeding mothers. But when a woman or a man who is not, a woman in particular that is not breastfeeding, sees that she starts producing milk, then it becomes a problem.
Okay. What are your treatment options?
So usually medications, depending on what is causing it. So if you have drugs that are causing it, we kind of stop the medications that are causing it, and then the person can go back to normal life. Yes.
So lifestyle changes as well?
Absolutely. Those are very, very, very important. So lifestyle, exercise, eating healthy, those are important things to do as well.
All right. But in all of this, we've talked about side effects. So, Dr. Ibidapo, are there potential side effects for treatment?
Well, yes. Some of the drugs we use, there is really no drug that does not have side effects. Even paracetamol does have side effects. So, but those side effects are minimal compared to the disease conditions.
Right.
Yes.
In terms of mental well-being as well, how does this kind of condition affect our mental health?
Oh, I've seen patients, come into the clinic and they look so worried, sometimes so depressed. For a woman who has been married for years, not having a child, that could be distressful or distressing for the woman. So it's something that can cause a mental health challenge as well.
Okay, so talk to those now. Those who might not be able to come out to really, really open up to us this morning. How can individuals with this kind of condition navigate relationships and intimacy, for instance?
Yes, so it's going to take both partners.
Okay.
To
really understand themselves.
Exactly, to really, understand each other, come to the hospital, seek for help, engage the endocrinologist, and let the person break these things down to you.
Right.
It may just be, just one test and one medication, and that will just solve the whole problem.
So you can say for sure, doctor, that this is curable, right?
Oh, absolutely, it is.
So they need not be scared then?
Absolutely not.
All right.
Absolutely not.
And Rjolad Hospital, what are you guys bringing to the table?
Yeah, so we do quite a lot of multidisciplinary care. The endocrinologist is also on board. The gynecologist for fertility is also on board. So that when it is an holistic care that we do, so that the patient or the person can get the best out of the illness.
All right, that sounds pretty good. So Rjolad, where is it located?
So we can contact us at www.rjolad.com, or you can also ring us at 07000 756523.
Okay, that's 07000 756523. All right. By the time you call those numbers, somebody will be at the other end.
Yes.
To also hear from you.
Yes.
All right, Dr. Ibidapo, nice having you in the building.
Thank you so much.
Thank you for bringing this very rare condition to the radio this morning.
Thank you.
And I hope somebody out there would have learned one or two things, especially when they see these kind of symptoms. And like you said, it's not just for females alone.
Yes.
Males too. That's the rarest part of the interview that I've had this morning. That some men can also secrete from their breasts as well. All right, Dr. Ibidapo, Raphael, nice having you in the building.
Thank you so much for having me.
All right, so this morning we've been trying to understand hyperprolactinemia and its impact on our life. And guesting is Dr. Raphael Ibidapo, who's a consultant endocrinologist with Rjolad Hospital. All right then, so a brief break. When I return, it'll be time to say our byes.
Nice. I take you on Arabam. You wanna stay strong. If you wanna live long and stay strong. Lock it up for anyone wanna live long and stay strong. Long over to me. Lock it up for anyone. Oku billion for anyone son.
All right, then. So you must have learned one or two things about this particular condition, and that means you need to take some kind of caution as well. Rest well, and of course, you can eat well, do some good exercises. You'll be prevented from all this. All right, then we have to go. The program has been produced by Mike James, Adamu Dorin, and Olaiwola Fetia in the building as well. Okpa Emishodunke is of our social media unit. Big shout out going out to him. And our executive producer is Tayo Akonle. My name is Victor Oteri. I'll be back by 10:15 for the benchmark.